Hello everyone. In FMGE, NEET PG, INI-CET, all these exam, most repeated adverse drug reactions type of the MCQ that we are going to discuss in today's video. If you are coming to my channel for the first time, then first subscribe my channel for more such exam related content. So let us begin. Which are the most repeated adverse drug reactions in the form of MCQ in all these exams? A patient receiving long-term antiarrhythmic therapy develops dry cough, dyspnea, and pulmonary fibrosis on chest imaging. Which drug is most likely to be responsible for this? And the options are lignocaine, amiodarone, verapamil, and diltiazem. Pulmonary fibrosis is a characteristic side effect of amiodarone. So here answer is amiodarone. Rest of the options are not true. A 25-year-old male patient on anti-epileptic therapy develops gum hypertrophy as shown in the image. Which drug is responsible for this side effect? Pregabalin, phenytoin, carbamazepine, valproate. Gum hypertrophy is a common side effect of which anti-epileptic drug? Phenytoin. So the correct answer here is a phenytoin. So this type of the image-based questions can also be asked in INI-CET, NEET PG and in FMG exam. So let us see this type of some common ADR which can be asked in your exam. So first is gingival hyperplasia. You can see here in the figure that is caused by phenytoin and nifedipine and cyclosporine. So this can be asked in form of the MCQ. Now next is hirsutism that you can see in this image and that is caused by phenytoin. So this can also be asked in the form of MCQ. Cleft lip you can see in the image that is caused by phenytoin, valproate and thalidomide. So these three drugs can be there in the option in the form of MCQ. So remember cleft lip is caused by phenytoin, valproate and thalidomide. Next MCQ. A neonate develops abdominal distension, vomiting, grey discoloration and hypotension after antibiotic therapy. Which drug is most likely responsible for this condition? So here grey discoloration, that means this is a grey baby syndrome. Grey baby syndrome, it is caused by chloramphenicol. So all this option amoxicillin does not causes this type of the manifestation, azithromycin and ciprofloxacin. This also does not causes this type of the manifestations in the neonate. So correct answer here is a chloramphenicol which results in grey baby syndrome. Now next is red man syndrome is commonly caused by. Red man syndrome is a side effect of vancomycin, metronidazole, ceftriaxone, linezolid. These all are not correct option. So here the answer is vancomycin. Which of the following drug can cause lupus-like syndrome? Amlodipine, hydralazine, furosemide and atenolol. Lupus-like syndrome, this is caused by hydralazine. So hydralazine is the correct answer. Amlodipine is a calcium channel blocker, so that does not causes this type of the syndrome. Furosemide is a loop diuretic that also does not result in lupus-like syndrome. Atenolol is a cardioselective beta blocker, so that also does not result in lupus-like syndrome. So correct answer here is hydralazine. Which of the following drug can cause tooth discoloration in the children? Doxycycline, ampicillin, azithromycin and cefixime. So remember tooth discoloration that is caused by doxycycline which is a tetracycline group of drug and this causes permanent teeth discoloration. Very important adverse effect of tetracycline group. Ampicillin, azithromycin, cefixime these are not correct option that does not result in tooth discoloration. Now next is which of the following drug causes Stevens-Johnson syndrome as a side effect? Carbamazepine, yes, that is the correct answer. Atenolol is a beta blocker that does not result in this type of the side effect. Digoxin also does not causes this side effect. Diazepam is a benzodiazepine that also does not result in Stevens-Johnson syndrome. So correct option here is a carbamazepine. Drug commonly causing ototoxicity is gentamicin, ceftriaxone, amoxicillin, doxycycline. So correct answer here is gentamicin, which is aminoglycoside group of drug and that results in ototoxicity, neurotoxicity and nephrotoxicity. So remember these three are the characteristic of aminoglycoside group of the drug. A psychiatric patient represented with the polyuria and polydipsia after prolonged drug therapy. Investigation suggested nephrogenic diabetes insipidus. Which drug is responsible for this condition? Valproate, lithium, haloperidol, carbamazepine. So correct answer here is lithium that is commonly used as an antidepressant. Here you can see psychiatric patient is given to you. So lithium is used as an antidepressant. So correct answer here is lithium, which causes nephrogenic diabetes insipidus. A 45-year man on antihypertensive medication developed dry cough. Which drug is responsible for this? Captopril, atenolol, diltiazem, amlodipine. Correct answer here, very easy question, captopril. That is ACE inhibitor. Atenolol does not result in dry cough. Diltiazem is a calcium channel blocker. Amlodipine is again calcium channel blocker. This does not result in dry cough. So ACE inhibitor, that is captopril, that is the correct option here. So these are the most commonly asked adverse drug reaction based and image based questions in the INI-CET FMGE as well as in the NEET PG exam that you have to practice. So if you like this video, then subscribe my channel and follow for more such pharmacology related videos. Thank you.